Hello and welcome to Group 27's final report. This is our slideshow describing our chosen disease, brain cancer. That is our focus. First, we'll start with the different body systems impacted by different brain cancers. So, brain cancers have two types of classifications in terms of location and origin. Primary cancers develop directly in the brain, and secondary or metastatic tumors have spread to the brain from different parts of the body. Focus here is the primary ones, just tumors that originate strictly in the brain, nothing that affects it indirectly, just anything. We're dealing with everything and anything that is originating from and inside the brain. The main body system we're looking at here that's going to be directly affected by the tumor in terms of like physical proximity is the central nervous system, the CNS. We're observing primary cancers involving the brain, brainstem, and top of spinal cord, anything in between the brain and the skull. While not having a physical proximity or direct impact to any other system, the CNS has a loose reach into every single system we have through motor function and nerve endings. So while brain cancers might not have a direct contact to other systems, they have this overreach into everything in like a slight way through all of our nerve endings and everything. As far as the changes to anatomy and physiology, the anatomy, what it looks like, you're going to see cancerous lumps, swelling in the brain, star-shaped tumors for certain varieties, and blockage or buildup of fluid in the brain. So if one of those cancerous lumps or one of the swelling areas gets too large, it could block the flow of all the fluid that goes through the brain and lubricates it and everything like that. So you could expect to see those with different variances. As far as the physiology goes, generally speaking, you'll see motor function hindrances, possible pain, and severe quality of life effects, and it can be fatal in different severities and types. So now we'll cover how patients experience the disease. We'll be covering the signs and symptoms, treatment, and quality of life. So starting with signs and symptoms, just a straight list, we've got weakness or numbness in one side of the body, severe headaches, vision problems, seizures and convulsions, difficulty speaking and conjuring words, loss of hearing, and trouble keeping balance. Now, as far as the impact on daily life, we're seeing frequent doctor visits and screening. They're time consuming and they can eventually rack up a lot of time under radiation exposure for like x-ray screenings and CAT scans and things like that. We're looking at intense treatment schedules, also time consuming. Potential pain and physical stress, and not to mention the emotional stress you'll experience. Being a patient of brain cancer is not easy. We're also looking at hindrance of loss of motor function, as we've described before, which can cause you to not be able to drive, or potentially even cause you to be bedridden at later stages and severities. Now we'll cover treatment methods and options. Firstly, the most routine one, removal of affected tissue via craniotomies. This is where a piece of the skull is removed to expose the tumor or the affected tissue. Won't always work or be an option depending on where the tumor is. Like if it's deep inside or if it's in a rough spot, it's not always going to be an option. We've got chemotherapy as well. That's the usage of drugs to destroy cancer cells and tumor growth. Radiation therapy. This uses primarily X-rays to irradiate cancer cells. And what this does is this damages their DNA, which will inhibit them from growing. That's the intent anyways. Tumor treating fields, these aren't as common, but what they do is they use these harmless electric pulses, these electric low tier pulses, to halt the growth progression of the cancer. It helps prevent it from dividing, so just growing farther and damaging more cells as it goes. I've also included a video that speaks about the process of a craniotomy from a doctor that explains your perspective, how the procedure would work and affect you, and generally what to expect. The video is from MD Anderson explaining why you should choose them for healthcare services, but I've included it because it shows and explains the standard procedure for the given operation. I'd also like to add that for all these treatment methods, typically a typically a patient would have multiple treatments. Not always, but you're never gonna have a patient be strictly under chemotherapy, another that's only being worked on through craniotomy. So you're gonna have a mix. You're gonna see mixes of treatments depending on the type, location, proximity, severity, age of the individual. There's a bunch of different factors that decide what is used and what's not, and what can be used together in certain scenarios. Now, I'm also going to cover some misconceptions we have about brain cancers that I want to cover. Um, Now, as far as terminology and classification, I'll explain this. In this bit, we're covering brain cancers or malignant brain tumors. Easy way to remember this: brain cancers are tumors, but not all brain tumors are cancerous. Think malignant cancers, same thing. In fact, some brain tumors can prove to be virtually harmless or benign or borderline. Misconception about brain tumors. It is true that not all tumors are cancerous, and that not all tumors are particularly harmful. But contrary to what you may think, there are non-malignant tumors that will still require some sort of treatment, like chemotherapy. Whether or not operations and treatments are made is a decision based on a few factors such as age and the size and effect of the tumor. Because you could have a tumor that's not cancerous, but it still be big enough to affect the surrounding tissue, and again, like we said, block fluid from getting to the rest of the brain and just cause swelling and impacting other areas just because of how large it's gotten. Because the skull, the space between the skull and the brain is very limited. In fact, there isn't much of it at all. It's not made to expand. The brain isn't supposed to expand. So when you have this space taken up, it'll still cause problems and will still have to be dealt with in most scenarios, whether they are cancerous or not. Now, in this segment, we're going to cover some disproportionately impacted groups. Um, there are higher rates among children under 15 and adults that are 65 or older. So we're looking at adolescent children, non-adults, and the elderly in the same group here. Survival rates for these groups, for brain cancer specifically, is around 33.7%, which is staggeringly low. For adults, males have a higher new brain cancer case rate than women by 30% on average. And note that this variance between sex is not present in children and non adults. Caucasians have higher rates of new brain cancer cases. It's a significant margin. It has a minimum margin about 15% regardless of sex. Caucasian males still have a higher rate than Caucasian females, just by a lower margin. Also, additively, families in low-income sectors, while while Caucasians have a higher new case rate, those who are in low-income sectors who can't afford the costly healthcare part of it will inevitably suffer higher casualties and have more intense quality of life impactments. What happens there is that it'll make treatment difficult or even inaccessible to those groups. They've got some key takeaways here that I want to go over just to emphasize the important parts of what we covered thus far. Although there are a lot of different treatment options, brain cancer types vary, so treatment plans aren't always going to be the same. It's not going to be copy and paste for every person. There's no standard way to do things with any one person because everyone's different, especially depending on age and different health factors of the individual. Brain cancer does not currently have a cure, and there's still constantly ongoing studies and trials happening to give patients better options for post-cancer life. We haven't fully gotten a cure for it. On the same side of that coin, while there are statistics and demographics and likelihood rates, the cause of brain cancers is also not currently fully understood. There are some types of brain cancers that have marginal genetic influence, or at least there's evidence to support a marginal chance at genetic influence. But generally speaking, we don't know exactly what can cause them. There are risk factors, but there is no one thing that we can discern that is the cause of all brain cancer or anything like that. Once again, stating that brain cancers are tumors, but not all brain tumors are cancers, to get that terminology solidified. And with everything mentioned in this informative, we are telling you guys to be alert to any symptoms and to not be afraid to schedule checkups in case of symptoms popping up or just anything that you might observe out of the ordinary. And it's always better to be safe than sorry. And here I've included the rest of our sources. You can find the linked YouTube video in the description. I will also link the sources and the physical text transcript in the description as well. Thank you guys for watching, and I hope you guys stay safe. Thank you.